Welcome to Hudson Valley Community Services, a group of committed individuals who provide care and a stabilizing presence in the lives of those who live with complex, chronic health issues.
Over the years, advances in medicine have allowed people with HIV/AIDS to live longer, so their needs have changed and grown more complex. So in response to that, we've had to modify some of our existing programs, add new services, add new staff, increase our facilities so that we're able to provide the help that these people need to deal with these new challenges.
Here at HVCS, we believe that each person deserves a chance to achieve the best quality of life possible.
As the healthcare environment is changing, this has created an opportunity for us to be able to work with many more folks with different backgrounds, different illnesses and chronic conditions.
We're very often the first phone call that a client makes, and we need to make that phone call important. Our care managers are trained to treat the client with respect and offer them the utmost of confidentiality.
Helping clients achieve a healthy, stable life takes a team approach. Our care managers oversee and provide access to all of the services a client needs to assure they receive everything necessary to stay healthy, out of the emergency room, and out of the hospital. It's all part of an approach to healthcare called Health Homes.
Health Homes is a model of care that assigns a care manager to work with an individual and all of the services that that person may need.
Services to clients with complex chronic medical conditions such as diabetes, hypertension, HIV and AIDS, hepatitis C, obesity, mental health and substance abuse issues.
That's what our case managers do. They're out and about every day, going with our clients to their medical appointments, to housing, helping them advocate. They're just there.
So our staff realizes that no two clients are alike. We look at their specific medical conditions, we look at their housing, we look at their mental health, at their substance abuse. We really look at the person as a whole.
I remember when I was a case manager, I would go through the refrigerator, so what do you have to eat? So you have no food? Let me help you. That's what we're here for.
HVCS provides that hands-on assistance through a number of support programs.
The transportation program is able to provide clients with transportation going to their medical appointments, social services.
They pick you up, they give you the service, they give you the nutritious food, and it's very beneficial.
The nutrition program was very important for me because I needed somebody to help me to put the weight back on.
Our nutrition programs provide food to those in need of nutritional support and assist clients with dietary issues to make healthful food choices.
There is no real reason to be embarrassed about feeding yourself or feeding your family.
But this program helps because, without it, I wouldn't be able to eat, to be honest with you.
It's a great idea to just have things reiterated to you, things that I've forgotten, what is really needed for someone in my condition. And the food that they supply me with, it's all the food that they've discussed.
Specialists on staff work with clients to navigate the complex system of government benefits and assistance and ensure that all clients have access to insurance and medication.
It could be very overwhelming for the client applying for these state-funded programs. So my job is to assist them and ensure that these applications will go through so it can be easier for them.
When I came, I was with my son. I was having lots of problems. I didn't have where to live. I was sleeping in the floor. They didn't have steam, no water. And Leanne helped me very much with my social worker in DSS, which she talked to my social worker, told him the problem I had, and right away, 2 months, they gave me the apartment.
The counselors kept telling me that they saw more in me than I saw in myself. And it took me some time before I started to believe in it. But when they finally introduced me to, say, the support groups, and I did finally start going to the care network, and once I started getting involved and that it was valued, and I got a sense of self-worth where I didn't have before.
Prevention begins with risk reduction counseling, paired with confidential screenings for HIV, sexually transmitted infections, and hepatitis. We work with high-risk individuals in the community through innovative programs, like our Project Reach Out Syringe Exchange van-based program.
We show them how to use the needle safely, how to clean the needle. We issue bleach kit to prevent, the spread of HIV or Hep C from, one person to another. Our approach is to show them that, we're here in the community to help you. There's always help and you're not alone.
We also work with incarcerated individuals in New York State prisons.
Hudson Valley Community Services has a history of working with disenfranchised populations. For me, the most disenfranchised population is prisoners. We do education, we go out and we talk to people in GED classes. Every inmate that comes in to the Department of Corrections, they have to go through an orientation period. We talk to them in there. We let them know that we're here, we're in the facility. My door is always open. If you want to come and talk to me, just to sit down and have a chat, that's fine.
HVCS is about keeping all individuals healthy, especially those at high risk for infection.
The Regional Prevention Initiative offers a range of HIV, STI, and hepatitis testing and prevention programs. We offer referrals, we offer risk reduction counseling sessions, safer sex kits, we offer educational materials to high-risk communities.
The CHAPS program at the Mosaic Center reaches out to young men of color.
It talks about, safer sex, proper uses of, prophylactic, the condoms.
We show movies sometimes we have just big group discussions.
We teach people just, again, learn to love yourself, learn to protect yourself, learn to be yourself at all times.
Success for our organization begins with awareness.
2, 1, and walk!
Removing the stigma associated with needing help is the first step.
There's that label of, if I come to you, then I'm in that pot of people that are dependent on the system or can't do things on their own.
Everyone needs help at some point. Anyone can find themselves in a situation where you need.
Don't be ashamed. There's people that will help you and that know what you're going through.
For over 3 decades, Hudson Valley Community Services has been in the community supporting those coping with long-term illnesses and their complications.
I think we have great leadership, I think we have great staff, and we have great clients.
They're definitely caring, they're definitely out for me, and they're definitely out there for the community.
Even if that one person is able to get into treatment that continues their sobriety and maintains, a healthy lifestyle makes me feel good.
I relate a lot to my clients. I know what it's like to be hungry. I know what it's like to be homeless. It hits somewhere in my heart where I know that the need is there.
I believe in the work that this agency does, and I've seen the outcomes of the work that we do.
Hudson Valley Community Services. We're here to assist you in improving the quality of your life.